Hi, everyone. Give it a few more moments, get into 101 to kick off, just to make sure we get everybody in, or as many people as possible. Alrighty, let's kick it off, everybody. So, good afternoon, everyone. Welcome to today's webinar, Nutrition and Wellness in Wound Care. I'll be your moderator for today, and I'm also the marketing manager for SSS Australia. My name is Ryan. I'd like to begin by acknowledging the traditional landowners of the land on which we meet today, even virtually. I'd also like to pay my respects to elders past and present and any First Nation peoples joining us today. Just a few housekeeping matters before we kick off today's presentation. This webinar is being recorded and will be available for viewing by SSS Australia customers after the presentation. We should have time at the end of the webinar for a Q&A session. So if you think of any questions during the presentation, feel free to pop them into the chat and we'll try to get to as many as we can at the end. Do keep an eye on that chat as well, as towards the end, I will be posting a link in there to the feedback form. This is how you can let us know your feedback on the session, as well as get your attendance certificate to go towards your CPD. So I'd like to welcome and thank our speaker for today, Dr. Michelle Gibb. Michelle is the founder and director of Wound Specialist Services and is an internationally recognized wound expert and nurse leader with a passion for improving patient outcome. Michelle has a PhD, Masters of Nursing Science, Masters of Wound Care, Bachelor of Nursing, and over 20 years of experience in the specialty of wounds across a broad range of health service content. I'd also like to thank our sponsors for today, Nutricia and Smith & Nephew. Nutricia's Fortiset family of products are ready-to-drink nutritional supplements that are high in calories and protein. Fortiset comes in many delicious flavors and encompasses several ranges, including compact protein, multi-fiber, and plant-based to meet a variety of different nutritional needs. And Smith & Nephew's Alleven Life dressings are a multi-layered dressing incorporating hydrocellular foam and a hyper-absorber lock-away core designed to optimize quality of life by locking away exudate and odor. For more information about these products, please reach out to your personal account manager and keep an eye on your inbox tomorrow, as we'll be sending out a follow-up email with a bunch of resources as well as a link to the recording. So without further ado, I'd like to pass it over to Michelle to get us started. Thanks so much, Michelle.
Thanks, Ryan. Thanks so much for the opportunity to be here with you today. One of these topics that's always interesting, but sometimes challenging. So I do appreciate the opportunity, and thank you to our sponsors also. I'm just going to start sharing my screen. Please let me know if there's if you can't hear it or can't see it rather.
Looking good.
All right, excellent. Thank you. All right, we'll get started. So wound healing is an important focus across all healthcare settings, and achieving optimal healing requires an understanding of nutritional requirements. So today we're going to learn more about the importance of adequate nutrition in wound repair and regeneration, and also touch on this concept of well-being, because often well-being and nutrition and hydration, or optimal nutrition and hydration, have a really important connection in terms of outcomes for individuals. So wound healing, as I said, is I've got these notifications that just keep sticking up all over my screen. Hang on, sorry, there we are. Wound healing is an important focus, as I said, across all healthcare settings, and achieving wound healing requires understanding of nutritional requirements, strategies to optimize well-being, and empowering patients to become more engaged in their care. Patients with wounds, as we know, face many challenges in their everyday life, including stigma, psychological stress, and often poorly controlled wound symptoms can impact on them as well. They can result in having a wound can result in social isolation, and it has a significant financial impost for individuals. Psychosocial factors such as anxiety and depression are frequently associated with delayed wound healing, and while inadequate symptom management and poor health literacy often can lead to non-concordance and resistance to care. Optimising wellbeing really is a collaborative strategy that we should all be aiming for in terms of our approach to wound management, because having a collaboration with the person with the wound and the broader families, carers and extended healthcare systems, healthcare teams can really optimise outcomes. So today we're going to have a look at the importance of well-being and on wound healing, and also looking at nutrition and hydration and the impact that that can have on repair and regeneration. We'll touch on the role of oral nutritional supplementation and why some individuals may be at higher risk of poor nutrition and hydration when having a hard to heal wound. So that's what we're going to look at today. Now, well-being, we all come across patients in our everyday work environments where they walk through the room or walk into the room and they'll tell us that every day is a struggle, that they're sick and tired of having dressings, the impact of that wound on their overall quality of life. Having a wound, and particularly some of these wounds that are complex or non-healing, the palliative, end-of-life wounds, can have a significant impact on quality of life. For some individuals, even the smallest wound can impact on their well-being. You probably only have to think to the last time that you injured yourself and the impact of what it was like having to have a dressing on and keep it dry in the shower, for example, and how it changes. These subtle things can change just what you take for granted as part of everyday life. Well, when we look at comments like these from our patients, we can see that well-being is this dynamic matrix of factors, including both physical, social, and psychological, and even spiritual factors that can impact on that individual. The concept of well-being is really inherently individual, and it often varies over time, and it can be influenced by culture and context as well. It can be completely independent of wound type, duration, or care setting. Within wound healing, optimising an individual's well-being is often the result of collaboration and interaction between clinicians, between the patients, their family members and any caregivers, and also the broader healthcare system and even industry providers as well. The ultimate goals of wellbeing are really to optimise wellbeing and to improve, or in some cases heal, the wound is your ultimate objective. But it may also be on alleviating or managing the symptoms so that all parties are fully engaged in this process. Comments like these are the ones that drive us as clinicians very often to try and lead to healing as the ultimate outcome. But don't forget that wellbeing can very much just be about improving symptom control and really thinking about what it is that is important to that individual. Now, as I said before, the concept of wound balance is multifactorial, and it can encompass interconnecting issues related to wound healing processes and also the clinical care that's being provided. The wound balance concept, and this is what you can see on the screen, is really aiming to integrate various parameters which offer continuity, individualised care and support clinical decision making to place the patient at the centre of all care that's being provided. Fundamentally, aiming for wound balance constitutes a shift in thinking from the management of wounds to leveraging the clinical intention of wound healing wherever possible. The patient and a clinician are really considered to be on a journey together and optimising their quality of life and looking at what their needs and preferences might be, as well as expected clinical outcomes at the centre of this decision-making process. Patient engagement is really essential to achieving outcomes and improving the patient experience. As we know, quality of life is a key component that's often misunderstood. It can be a real challenge to measure and quantify, and it's often harder to apply this to evidence-based practice. Living with a wound is often different to living with other chronic conditions like heart disease and diabetes, for example, and the care for a person with a wound needs to be really individualised accordingly to patient communication styles and listening being at the core of all interventions. While healthcare systems and settings do vary, this change in focus is really needed to be able to facilitate a transformation in our clinical practice. Ritualistic practice needs to be eliminated through understanding the science, the art and science of wound healing, and applying this to the individual patient and their unique needs. Clinicians' lack of specialised knowledge or confidence in wound care often leads to suboptimal practice, such as failing to address the underlying contributing factors to the wound or not selecting the right individuals based on the individual's patient needs. Considering whether a specific treatment approach is in the best interest of a particular patient is really essential. And clinicians should always ask themselves whether the most familiar product is to them is the most appropriate for that individual. We often have that tendency to reach for things that we're familiar with rather than thinking about what else is out there that could help to manage those wound symptoms best for that individual patient. And we don't talk to the patient about what dressings we're selecting either and whether they're happy with the product choices or the experiences that they might have had. So this wound balance approach is aiming to provide clinicians with information to understand the science of wound healing, in addition to the skills in how to communicate this effectively with patients to help them get the best out of their treatments and ultimately to achieve good clinical outcomes. A change in the way that we think about and discuss wounds is really needed, focusing on healing where appropriate as opposed to just managing the wound. Ultimately, this can reduce the cumulative burden of wounds, easing the pressure and psychological stress on both patients and clinicians. Now, thinking about these things in context, I want to take you through a case study scenario. Glenda is someone that I met in my clinical practice, and she represents a typical example of a person that has a chronic wound and what their care experience or their care journey might be like. I'll be reading this to you because I want to ensure that I capture Glenda's words. It's really important. I think she's got important messages to help us understand the impact of a wound on wellbeing. And it also relates to nutrition as well when you hear some of the comments that she might have. And I'm sure when you think about your clinical practice experience, you all have stories like these that you come across in your daily lives. And they are rich opportunities to enhance our learning, understanding, and change our approach to wound management. So Glenda says that I got my first leg ulcer just over 20 years ago. It started as a scratch on my leg, but it soon got bigger. I saw the doctor for a few months, but it didn't get any better, so I went to the hospital. The doctor there scraped it back and it got even more painful and continued to worsen, so I stopped going back. Having an ulcer takes over your life. It never seems to be out of your mind. One day I heard on a radio about the success they were having with manuka honey and jellybush honey to heal ulcers. It kept the wound clean, but it didn't get any better when I tried it, and neither did the pain. I had nurses coming to me at home, but this provided no results either. Every week, a different nurse would turn up. They were lovely girls, but they just never seemed to know what they were doing and were always in such a rush. I would have to wait around all day. Sometimes they didn't turn up at all, and I would have to do the dressings myself. Because of the smell and the leakage, I went to see another doctor who knew about an ulcer clinic at the hospital where they use compression bandaging. He sent me there, and 8 months later, it was finally healed. In August 2009, I developed my second ulcer. This was when I discovered a specialist clinic. The service was great. It was like having a miracle performed for me compared to the previous ulcers and all the problems that went along with it. It was fully healed in just weeks. My third ulcer began in February of 2014, but the doctor wouldn't give me a referral to the specialist clinic again. He said that he could fix it. Sure enough, though, it grew and grew from the size of a 5-cent piece to more than the size of a 50-cent piece, right over the top of my previous scar. The pain was the worst that I had ever had. After 6 months of visiting the doctor 3 times a week and getting absolutely nowhere, I finally got a referral when the doctor and I both realized it was hopeless. I started going to a wound clinic within 4 weeks it had started to close again, and in 8 weeks it had nearly healed. In the years it took to heal my ulcers, my life was totally changed. I never seemed to be thinking pleasant thoughts. It was always about the ulcer, about where I could go to get help. The smell of the wound just before a new dressing change would put me off going anywhere or meeting new people. Cooking meals had to be quick and easy or not at all because of the smell and the pain. Having a shower was a drama. Having to keep the dressing dry using large kitchen tidy bags and elastic is often easier said than done, particularly when you need to be in the shower to wash your hair. I would also feel as if the house was in a constant state of disarray. After doctor's appointments, trips to clinics, and battling with pharmacy assistants, the last thing that I wanted to do when I got home was clean. After a while, this got me down as well. It was just another thing that made me feel helpless. I think what makes this hardest of all is just how difficult it was for me to get around. When a doctor says that you have to have a dressing 3 times a week, they don't realize how hard that is and what it takes out of you when you have mobility issues. When I saw a wound specialist, I was really relieved. I felt fortunate to have someone who knew what they were doing. But the biggest relief of all was that my symptoms were better managed. And finally, of course, my wound got better. Now, stories like Glenda's are all too common. We hear this every day in our clinical practice, and it's the same regardless of whatever healthcare setting that you might be working in. There are specific patient-related factors that can impact on wound healing. As Glenda identified, a lack of trust in healthcare professionals and that lack of a therapeutic relationship can have a negative impact. Also, negative emotions, things like anger, frustration, depression, anxiety, and even embarrassment about the symptoms can impact on that person's well-being. The social determinants of health can also impact the costs associated with having a wound, a lack of support and engagement, and participation in interaction with the healthcare professional, family members, and other significant others. Sometimes there's a real misalignment of these patient goals and priorities. For example, what was important to Glenda wasn't necessarily what was important to the healthcare professionals, and that leads to that I was going to say unsynchronization, but that's not the right word. But a lack of confluence, if you like, between what the wishes are between the parties. Now, obviously, these have a negative impact on quality of life and well-being, and they impact the physical, emotional, social, and spiritual well-being of the individual. Sometimes there is this inadequate health literacy and education, not being aware of what the underlying etiology or cause of the wound is like, can further impact on that well-being. You know, this feeling that the wound is a normal symptom or a normal part of getting older doesn't necessarily mean that person understands that it's not something that they should be satisfied and happy to live with for the rest of their lives. It's not normal to have a wound that doesn't heal. And as I said before, lack of resources, financial constraints can have an impact on well-being as well. It's not just the dressing products, as we know, it's also the transport costs associated with getting to appointments. It might be the impact on family members and other caregivers that need to take their loved one to appointments, for example. And of course, the broader socioeconomic impacts on the terms of the broader healthcare system. Now, in addition to patient-centric factors, the wound and the skin balance can also have an impact on healing. We know that often hard-to-heal wounds have this pathologic state of inflammation. There's often this imbalance between too much moisture and not enough moisture to achieve wound healing. The concept of biofilm, that invisible plaque on the wound that is impenetrable to antimicrobials and a lot of the products that we use. This can potentiate further inflammation in the wound. Having recurrent infection, having inadequate oxygenation and perfusion, whether that's pressure injuries, leg ulcers, for example, diabetic foot ulcers can also impact on wound healing potential. Having recurrent trauma or wound recurrence are also things that impact on the wound. And of course, the underlying health conditions and overall general sense of health and well-being for the individual, and of course, nutrition and hydration. Having that or achieving a wound and skin balance is also important. Now, this clinical practice balance is also something that needs to be taken into consideration. Clinical practice issues can affect this balance and well-being, and these can include not recognising contributing health and age-related factors and medical conditions that can have a potential to affect wound healing. Having limited or inappropriate wound care practices, inconsistencies in wound care, and missing the early warning signs of a non-healing wound. Having ritualistic or outdated wound care versus evidence-based practice can also impact on wound healing potential. Having ineffective education and training, lack of confidence of healthcare professionals, having a lack of interest or being unaware of the impact and influence of inappropriate care. And also time constraints and lack of resources are considered to be clinical practice issues that can sometimes be out of balance. Now, in terms of these things that we've identified, it all sounds really doom and gloom, but there are strategies that we can employ to be able to achieve a better balance in terms of looking after a person or maximising their well-being. Some of these patient-centric assessment and diagnostic factors might be recognising that the patient-centric factors can change over time as the wound situation changes. And therefore, we need to make sure that we're doing this regular and frequent assessment and reassessment of the wound and also the goals of healing as well. We need to incorporate cultural sensitivity, encourage engagement as much as possible with the person with the wound, and of course involve their patient, not only the patient, but family and caregivers as well. We need to be considering patient choices, so ensuring health literacy, assessment and education, having demonstration and reviews self-care capabilities for determination of treatment options, providing patient communication at a level and style that helps them to meet their learning needs, and reviewing understanding of their capabilities on a regular basis. Cultivating therapeutic relationships and being respectful of communication that develops trust and engagement is really paramount. In terms of balancing a patient's quality of life, one strategy that's been posited as improving quality of life can be by determining short-term goals based on the immediate needs or actions that need to be controlled, such as managing uncontrolled pain or exudate. Sometimes for patients, that's one of the most important interventions that you can do. So whilst your goal might be ultimately to achieve wound healing, looking at things like the impact of exudate and pain may take priority. And explore how the wound and treatment has or is impacting on their life. You know, we talk about the compression therapy for venous leg ulcers. Is that something that's working for that individual? You know, what are the challenges or things that might be leading to non-concordance, for example? It's also really important that we measure outcomes and quality of life and on well-being. Consider using simple and easy to use validated quality of life assessment tools or well-being tools to help identify and monitor patient outcomes over time. You also obviously need to use these tools in combination with our own clinical judgment and of course local policies and protocols as well, and consider cultural sensitive issues as barriers to healing. In terms of wound-related strategies and the things that you can do, we're looking at these biomarkers of imbalance. So these are the scientific signs and symptoms that the wound may not be heading in the right direction. So make sure you understand the signs and symptoms of wound infection and inflammation, and look for signs and symptoms of this at every dressing change. Understand and implement therapeutic wound and skin cleansing. And employ appropriate debridement methods. You know, there are things that you can do as part of your everyday clinical practice that can really help to improve the wound environment. Consider using appropriate antimicrobial dressings. These can include medicated and non-medicated dressings, and of course the use of superabsorbent dressings to cope with the volume of exudate that wounds often produce. What we're wanting to do is to normalize or rebalance and maintain a healing trajectory where possible. Having that holistic approach to assessment and management of wound symptoms and monitoring that over time is one way that we can help identify symptoms early. So if a wound isn't progressing as you would expect after 4 to 6 weeks of optimal wound care, then that would be a red flag or a trigger that you may need to refer on. Managing exudate, as I said, looking after that surrounding skin is really important. Early identification and intervention are factors that can help to maximise quality of life and determine what wounds are healable, non-healable, or require maintenance of clinical outcomes. In terms of care strategies, things that you need to think about here about identifying and managing challenges that can impact on providing consistent and optimal care, such as access to resources. Look at policies and procedures that create red flags or triggers for referral, and having the resources and strong professional networks in place to enable you to work collaboratively with that broader healthcare team for patients with hard to heal wounds. Making sure that we have a realistic time balance in our daily clinical lives is also something that can help to ensure that we're taking the time to listen to our patient goals and implement evidence-based care where possible. So there's lots of things that we can think about. You know, stories like Glenda's are not uncommon. You know, we know that the impact of the wounds can have on a patient's overall health and well-being, but there are lots of simple strategies that we can take that help to achieve a better wound balance and improve quality of life. Now, obviously, good nutrition and hydration is an important part of quality of life as well. It also plays a vital role in maintaining healthy aging. Because of age-related physiological changes, limited access to nutritious food and the presence of comorbid conditions places older persons in particular at increased risk of malnutrition. Now, malnutrition and undernutrition are often characterised by insufficient intake or absorption of nutrients, which can result in an altered body composition. This can lead to decreased physical and mental functioning, frailty, and impaired clinical outcomes from comorbid conditions. Malnutrition is associated with poor overall health, increased utilisation of healthcare resources, higher rates of falls and fractures, of course, delayed wound healing, and an increased risk of infection and accelerated mortality. Current estimates on the proportion of older persons in long-term care facilities at risk of or diagnosed with malnutrition vary quite considerably, from 30% to more than 70%. And when compared to older persons living in the community, malnutrition in aged care homes is quite significant. Prioritising interventions to combat malnutrition is really essential for optimising well-being and quality of life. Now, the consequences of poor nutrition are significant and often irreversible in older people. It's not to say that poor nutrition and hydration is expected as a person ages, but if they do develop these signs and symptoms, sometimes they are irreversible. And weight loss is not a normal part of the aging process. When we're thinking about nutrition and the impact on wound healing, we know that for those with older persons in particular with wounds, that often their previous experience of malnutrition can place them at increased risk of poor nutrition into the future. Some of the age-related changes, such as anorexia or a change in appetite, the presence of nausea, often breathlessness, and conditions that result in a decreased oxygenation and perfusion as a result of poorly managed health conditions, can place them at increased risk of malnutrition. The person's overall body habitus changes as you start to age as well. So subtle signs and symptoms of muscle loss or weight loss, such as clothing not fitting correctly, where they say that their continence pads are falling down where once they were able to stay in place. Not having opportunities to maximise physical strength and mobility are things that can increase that risk of frailty and lead to poor nutrition. And of course, the older you get, sometimes you do have those changes in the change of food type because of the symptoms of dysphagia, for example. They often lack enjoyment in meals. Sometimes people, particularly those with wounds, become very socially isolated. So they tend to sit in their rooms because they don't want to socialise with others because the fear of the smell coming from the wound. Or for those living in the community, they stop making their own meals because it's just too painful to stand and cook, or they don't like the smell associated with their wound, and so their appetite decreases and their oral intake declines as well. And then, of course, there's medication impacts and the impact that can have on nutrition and hydration for older persons as well. For those of you who work in long-term care facilities, we know that there's been strengthened national aged care quality indicators, particularly around the standpoint of nutrition and hydration. So weight loss is now considered to be a key measure and a reportable adverse event. And there are lots of great resources in terms of guidance available to help us working out what we need to be focusing on in terms of optimising nutrition and hydration. In a recent Australian study, it was found that around about 68% of people were malnourished in long-term care facilities or at risk of malnutrition. It's a requirement that long-term care homes have systems in place to detect when a person is malnourished or vulnerable. Weight loss is often considered to be an indicator of malnutrition, but a person can be malnourished without weight loss. In fact, just the other day, I saw a patient through telehealth and she was morbidly obese, but she had an enormous amount of exudate produced from the wound. And while she didn't have any particular signs and symptoms of weight loss, she wasn't regularly being weighed. She had malnutrition because of the high volumes of protein lost through the wound exudate and those increased requirements for pressure offloading and management. Also, malnourishment, as we know, can harm health, well-being and quality of life. The food quality and dining experiences can also contribute to poor nutrition. Now, for people with wounds and older persons in particular here, we know that there are lots of different reasons that people will not eat, and it often becomes heightened in the presence of a chronic or hard to heal wound. Sometimes it's a communication thing. People don't communicate their likes and dislikes or preferences for food. We may not be aware that their appetite has decreased or that they're not able to access or have the financial resources to be able to spend on good food. There may be cognitive changes or sensory issues associated with a decreased oral intake. Physical difficulties such as swallowing, dysphagia, appetite and dexterity are recognised factors that can impact on reasons for not eating. Having availability and choice, increased or variable needs for nutrition and hydration, as I referred to before. For someone with high volumes of exudate, often their nutritional requirements are more substantial. Then, of course, there are cultural and spirituality reasons that might impact on on nutrition and hydration, and also a person's mental health and sense of well-being. So advocating for older people is really important when it comes to nutrition and hydration. The availability of food sources, such as when, how, and where to access what's available. Looking at having genuine choices available, particularly in long-term care facilities. Helping them to make good choices when it comes to informed consumption decisions. Having good communication and having that therapeutic relationship is important. Providing clear and positive information on food, drinks, and the potential need for oral nutritional supplementation. Having feedback and advocacy is one way that we can make sure that we're monitoring and advocating for the needs of our older persons or those who might be at increased risk of malnutrition in the community. Encouraging movement and mobilization is important as well. For those with wounds, often the need for bed rest and leg elevation for those with lower limbs is often prioritized in terms of optimizing or reducing lower limb edema, for example, and managing the symptoms of chronic venous insufficiency at the risk of increasing frailty and increasing dependence and risk of other wounds from developing as well. But encouraging movement is an important component of optimizing well-being. And of course, making sure that we promote referral. So if someone is at risk of malnutrition or poor oral intake, then referring to a dietitian early on is important. Malnutrition screening, and this is across the board and also for those with wounds, is that if you're noticing that there are changes in oral intake, so they're not eating as much, they have missed meals or less snacks, when you're taking that history and they're telling you what they eat for breakfast, lunch, and dinner, or what they're not eating, they're really important clues that someone may be at risk of malnutrition. If there's weight loss or unexplained weight loss, if there's a loss of muscle strength and tone or reduction in mobility, if they have increased expenditure, for example, if a person has a pressure injury and they're requiring frequent repositioning, that consumes a lot of energy and can place them at that risk of protein energy malnutrition. Higher needs, so if they have a changing wound status, so it's increasing in size, increasing in the volume of exudate, or they've got poorly controlled comorbid conditions, these are things that might place a person at increased risk of malnutrition. And also for those who need special monitoring, so if they're on food and fluid balance charts, if there's that higher volumes of wound exudate, monitoring things that can increase that risk of malnutrition is important. Now, proper nutrition, as we know, can help to support the skin and muscles, and that can help to reduce the risk of wounds occurring and also to promote wound healing if a wound does occur. Quality nutrition is comprised of adequate calories to help maintain muscle mass and weight. Protein repairs and maintains tissue and muscle function, which can help a wound to heal. And amino acids such as L-arginine are conditionally essential amino acids that are critical for wound healing. Proper hydration carries nutrients throughout the body, and vitamins and minerals are associated with healing. Micronutrients is a group terminology for nutrients that are found in the body in minute concentrations, but they contribute essential amounts for optimal function and homeostasis. This grouping is made up of vitamins, minerals, and trace elements. And micronutrients often provide cofactors for many necessary enzymatic processes in the body. Some micronutrients, such as fat-soluble nutrients, have good reserves in the body when dietary intake isn't adequate or it's not in a healthy state. During periods of stress, such as when you have a wound, their intake becomes even more essential. Ascorbic acid, or vitamin C, is possibly the most well-recognized micronutrient for wound healing and immunity. It acts as an antioxidant as well as essential for collagen production in wound healing through its role as a cofactor during collagen synthesis. Similarly to vitamin C, zinc is also recognized as an important role in an immune function for wound healing. Deficiency of zinc can lead to a suppression of cell proliferation, so that slows down the wound healing response, particularly for those wounds in that epithelializing stage of healing. Iron is an essential role as part of hemoglobin, which is needed for oxygen transport to regenerate wound tissue. It's also a cofactor necessary for collagen synthesis, and the role of vitamin D, calcium, probiotics, bioflavonoids, and folate are less well understood. Conditionally essential amino acids are of particular interest in wound healing. We all hear about our residents and or clients that are placed on oral nutritional supplementation with their arginine amino acid to optimize wound healing. Arginine falls under the conditionally essential amino acid, which under normal circumstances are available in adequate amounts in the body. But in periods of stress, such as when you have a wound, additional exogenous sources are often needed to optimize nutritional function. Examples of arginine and examples of conditionally essential amino acids include arginine and glutamine, and it's been demonstrated to promote wound healing, stimulate insulin-like growth factor 1, and pituitary hormone growth hormone. It may also have a role in T cell proliferation. Glutamine acts as a direct source of cellular energy and can assist with metabolic functions. It can stimulate the immune function and wound healing, and can act as a fuel source for lymphocytes, macrophages, and fibroblasts, which are the key building blocks for wound repair and regeneration. It also preserves gut integrity and supports its antioxidant function. Now, hydration is often an underlooked source of optimal nutrition and optimal part of wound healing. We often take for granted that, obviously we have a glass of water with a meal, for example, but many people, particularly older persons, reduce their fluid intake. So hydration is a really critical and yet often underestimated factor in wound healing. Proper hydration supports the skin's elasticity, it enhances circulation, and ensures the efficient transport of nutrients to the wound site. Dehydration can impair tissue perfusion and delay collagen synthesis. It weakens the immune response, which are all needed for wound healing. And this is particularly important for older persons who are at that higher risk of dehydration and have a diminished thirst response because of often comorbid conditions. So when we're looking at the important nutrients, there's really across the board a whole range of nutrients and, of course, fluids that are needed to optimize nutrition and hydration, and also a person's overall sense of well-being. Protein is considered to be the building block of wound healing. It's the building block of muscle and lean tissue body fat, as well as for cells and immune function, and also for collagen synthesis. Now, of course, a person's protein needs often vary quite significantly, and protein needs to be spread across the day because the body doesn't store it. So where possible, we recommend that protein sources are included in both breakfast, lunch, and dinner, and also snacks to fuel muscles and to prevent loss of strength. High protein sources in lots of different ways, and it's important to consider broadly across the diet where the sources of protein could be incorporated into the diet. Now, when you have a wound, often the nutritional goals will be dependent very much on the type of the wound. So is it a chronic or hard to heal wound, a surgical wound, or a palliative wound? What is it that we're trying to achieve, and how realistic is it? In terms of, are we seeking to repair the tissue, or is it our goal to reduce further wound breakdown, or is it to heal it so that the wound never comes back again? We need to be thinking how the wound is managed. What is the frequency of dressing changes? What is wound-associated pain like? What kinds of products are we using, and what is the experience of the clinician? We need to be thinking about nutrition in terms of circulation versus period of rest. How can nutrients get to the damaged tissues versus waste products that need to be moved away from the site of tissue damage? For example, when you think about the role of compression and reducing lower limb edema, we obviously are shifting large volumes of fluid during that time period when we're using or initiating compression therapy. So how do we get nutrients to the tissues in that sense? Now, obviously, having a wound can increase nutritional needs beyond the normal functioning state. And as we've already identified, malnutrition is often common in older persons. Having a wound increases our energy expenditure, our protein needs. It can lead to inflammation, and chronic diseases can impact on the wound healing process as well. So wounds that often need more nutrition are those that have higher levels of exudate. So anything that's producing, or any wound that's producing moderate to large amounts of exudate, may benefit from increased nutrition. Wounds that are slow to heal, wounds that have clinical signs and symptoms of infection. The more wounds a person has, obviously the higher the need for adequate nutrition and hydration, and larger wounds, so wounds that cover a larger surface area. Now, often the question that comes hand in glove with this, well, how much do we need? How much is enough? Well, individual assessment is really the answer to this query, because essentially having good nutrition is really dependent upon the comorbidities and other factors that are influencing intake and expenditure for requirements. For example, your nutritional intake or protein needs requirements may be lower if you had chronic kidney disease, for example, thinking about the way the body metabolizes nutrition. Thinking about the type of wound that you have and the amount of exudate, the surface area that might be involved, and whether malnutrition is in fact actually required. So the international guidelines, clinical practice guidelines for pressure injury prevention and management identify that there are 4 key areas that we need to be thinking about for pressure injuries. And these recommendations are often transferable for other wound types as well. Prevention of poor nutrition means that we use a validated malnutrition screening tool and have early intervention and have flexible nutrition planning. Intervention is really focused on food first, and if nutritional requirements cannot be achieved by normal dietary intake, that's when we start thinking about offering calorie and protein fortified foods and or oral nutritional supplements. High calorie, high protein, arginine, zinc, and antioxidant oral nutritional supplements or enteral formulas for those with stage 3 or greater pressure injuries, and those who are malnourished or at risk of malnutrition is clinically recommended. Timely collaboration and planning to achieve clinical goals and adapting the plan of care with changes in health status is really important. And action for nutrition involves developing a personalised nutritional plans to support those with chronic wounds or those who are at risk of malnutrition or who are clinically malnourished. Now, oral nutritional supplementation is often a contentious area, and it's a potentially effective strategy for managing hard-to-heal wounds. The administration of specialised formulas encompassing macro and micronutrients are significant in managing hard-to-heal wounds, particularly those producing higher volumes of exudate. Results of a recent study indicated that an oral nutritional supplement that's rich in calories and protein, regardless of the type of amino acid, and that's been fortified with zinc and vitamins A, C, and E, can be beneficial for wound healing. The specific optimal quantities of each nutrient to enhance healing are not really clear, but literature suggests that high calorie, high protein formulas with high amounts of vitamins and minerals and such as zinc are of benefit. The effectiveness of arginine, a component of many wound formulas, is really contingent upon its combination with protein and antioxidant micronutrients that are essential for wound healing. Arginine has been shown to be of benefit for pressure injury healing, but there are gaps in research, and particularly for other wound types. But arguably, the use of oral nutritional supplementation does need to be carefully monitored, and its use does require a holistic approach to assessment, implementation, and monitoring of nutritional interventions. Now, when it comes to oral nutritional supplementation, this is where that individualized assessment is really important. Having a dietitian involved in the care plan is really important, looking at both anthropometric and biochemistry measures of nutrition and hydration. Often oral nutritional supplements taste better cool than if they're off the shelf. Often liquid or thin oral nutritional supplements may need to be modified for those with swallowing difficulties. A tip that was given to me by a dietitian, have you ever noticed with like those popper or Tetra Pak type boxes, how they've got the wings on the side? If you pop those up, that helps the person to grip the nutritional supplement more effectively without having to grapple with difficult straws and squeezing the Tetra Pak, which can result in spillage. Oral nutritional supplements and non-capsule or tablet formulas can also be of benefit. And there's also obviously powders and liquids and biscuits and things available for those who dislike the texture of the different types of supplements that are available. The important thing to consider if you are using an oral nutritional supplement is to individualize it. So if a person is saying to you, I don't like the flavor of, or, milk-based supplements upset my tummy, it's far better that we listen to those cues and try and find a supplement that suits them, as opposed to enforcing one that may have a particular ingredient that's perceived as being of benefit for wound healing. So any nutrition is better than no nutrition. Obviously, getting a dietitian involved is really important if someone is at high risk of or has current wounds, and particularly wounds that are proving hard to heal. If a person has poor oral intake, cachexia, muscle wasting, loss of appetite, they've got poor hydration or fluid restrictions, whether that's intentional or unintentional, this is someone who would benefit from a dietitian. Patients who have immobility, pressure injuries, particularly stage 3 and 4 pressure injuries, lots of movement, so they're very active people. If they've got poorly controlled comorbid conditions, and where there may be a temporary dietary increase because of the presence of the wound. Dietitians are really valuable members of the healthcare team and often underutilised when it comes to those with chronic wounds. Now, fortunately for us as wound clinicians or as health professionals, there's lots of really useful resources that we can access that try to make this whole concept or this topic, a complex topic, more accessible. There's some really good website resources, and these will be made available to you after today's presentation. But for those working in the aged care environment, there's some really good free resources that are out there to look at how you optimise food and nutrition for those living in long-term care facilities, but where there's particular interest for those with chronic wounds like pressure injuries. We've all heard about the wonderful Maggie beer, and there's some resources available on ABC iView. Lantern Alliance has got some information on improving quality of life through food as well. And also there's other resources like the Nutrition for Wound Healing advice, which could be of benefit. Notably, the Australian Guide to Healthy Eating isn't designed for wound healing or supporting malnutrition. These are generalist recommendations for you to consider when looking after a person with a wound. So as we've sort of touched on today, quality of life can be significantly impacted by a person living with a wound, and it really does impact every aspect of that person's life. Consumer engagement and addressing quality of life factors to improve experiences can really help to improve outcomes. Having a wound balance or achieving a wound balance requires an understanding of both the science and, of course, the art of wound healing, and, of course, fundamentally, that individual person's needs. Optimizing nutrition and hydration can also optimize well-being and enhance wound healing outcomes. And us as healthcare professionals have a really vital role to play in making sure that we can help to optimize well-being and, of course, nutrition and hydration. Now, that is a massive topic. Lots of big words were used in there. And if your mind is boggling, then absolutely so is mine as well. But we do have some time now for questions. So I will stop sharing my screen in just a moment. Lots of references available for today's presentation as well. As I said, we'll make a copy of the presentation available after today's session. I'll just stop sharing my screen. And now we've got time for some questions. Thank you.
Amazing. Thanks, Michelle.
Thanks, Ryan.
So yeah, if you have any questions at all, feel free to pop them in the chat. We've got a fair few minutes now that we can go through those. And do also, while those questions are coming in, please make sure that you fill out that survey that I've just posted in the chat to let us know how the session was, and to also get your certificate, namely. So yeah, that link should be in the chat now. So please make sure to do that. But yes, if you have any questions, feel free to pop them in the chat, and we'll get through as many as we can.
I'm puffing, so I know I spoke really fast. Everyone's probably catching up.
You could talk all day about it, couldn't you? Like it's such a massive topic. I mean, just as some cross promotion, we've got 2 more. We just had a webinar last week on talking about nutrition as it pertains to Alzheimer's, and we've got 2 more webinars coming up. One, I think, on the 18th and one on the 25th. 2 more webinars, one also from Nutrition, who's one of the sponsors of today's webinar, around, now I'm blanking, oh no. So many webinars going on, there's so much education to do. Another nutrition-based webinar, I think it's malnutrition, sorry, yes, that's the one. Another one centered around malnutrition on the 18th, and then we have another wound care related webinar sponsored by Moonliquor and their new product, Mapilex Up, on the 25th. So please be sure to register for those and check those out as well. But wonderful. Okay, yeah, we do have one question here from Lorraine so far. Michelle, how do you convince patients taking Lasix to drink more fluid?
That's a great question because it's a hard one because Lasix is obviously a diuretic. So often people are put on diuretics for a whole range of different reasons. But one of the things that we know as a side effect of a diuretic is that it makes them want to go to the toilet more. And that is the last thing often someone with a chronic wound wants to do. You know, getting up and going to the bathroom is a physically traumatic experience and you know can result in pain and increased exudate and all sorts of other consequences. The important thing, I think, or one way to help convince someone, if you like, who his requirement to have diuretics is that we need to have good hydration to replace what's being lost as well. So obviously, if it's a wound situation, they've got high volumes of fluid lost through the wound, so high volumes of exudate. And of course, then they're going to the bathroom or because they're on the diuretic. So they have the risk of developing dehydration quite rapidly. And of course, in a really hot climate in the summertime, we know that that increases the amount that we sweat as well. So potentially dehydration is a real concern. So having one way to help convince, if you like, or bring that patient on the journey with you is to stress the importance that our bodies are made up of mostly water. So replenishing our fluid sources is important. Having fluid easily to hand. It used to be, and I know this sounds very old school now, I'm showing my age, but it used to be that you'd go around every morning and you'd top up water jugs, for example, in both in aged care facilities and in hospitals to make sure that they have their 2 litre jug of water and a glass full of water, and it'd be just within hand reach. But we don't see that now. You know, COVID probably squashed a lot of that because of the risk of cross-contamination and all sorts of things. But making sure that you've got fluid sources close to hand is important. Also think broadly about your fluid choices. You know, ice cream, jelly, cordials, these kinds of things also contribute to fluid intake. So if someone doesn't like the taste of water or they find it difficult to swallow, think of other sources of fluid that are not necessarily then going to upset other comorbid conditions as well. So I think good communication and thinking broadly about what are the challenges around fluid intake is important. And obviously, if there's fluid restrictions, then working with the medical team as well to make sure that we're not overloading or dehydrating someone through the other reasons that person might be on a diuretic. Hopefully that helps a little bit.
We've got another one from Kimberly. Would you still advise a high-calorie protein for someone with elevated BMI that is malnourished?
Well, that's a good question, Kimberly. And I guess it does depend on how much exudate the wound is producing and what their physical energy expenditure might be as well. So someone can be, morbidly obese, but have very poor oral intake, and their caloric needs may be reduced because of the fact that they're not necessarily moving or have the ability to move, but it doesn't mean to say that they can't go into a protein energy malnutrition. So this is where that individualized assessment is really important, and working collaboratively with that multidisciplinary team. So I think if there's a question around that, access further information and support, because we obviously don't want to compromise the overall health and well-being of that person. You know, it's easy for us to sit here today and say, yeah, we need to put oral nutritional supplements for those with high volumes of exudate or high energy expenditure because of the need for frequent repositioning. But we do need to very much take into consideration what the overall health status is like for that individual as well, and what they want as part of their healing journey as well.
Awesome. We have another question from Ainsley. Would you prioritize wound healing or kidney function for someone with CKD and a chronic wound in terms of protein intake?
Oh, that's a really good question. Well, of course, we're all woundies, aren't we? So we want wound healing to achieve, but at what risk? So, we need to really consider the underlying health condition first and foremost. I often say that a wound is a symptom of an underlying condition. So if someone's got, severe CKD, stage 3, stage 4 CKD, they're probably leaking fluid from their legs because of a poor renal function. So their body shuts down the circulation to where it needs it the least, and that's usually the lower limbs. And so we often see leaky legs in people with CKD. That doesn't mean to say then that we need to, administer oral nutritional supplementation or look at prioritizing wound healing. We need to optimize the underlying health condition. If we get the health condition stabilized, then often the wound healing improves automatically. So I would always say prioritize health conditions first, and then wound healing should come along to the party, hopefully.
Awesome. Finding another question here. What is the cheapest / most easily accessible nutritional supplement you would recommend for people who are challenged financially?
Oh, that's a really complicated question.
It is, yeah.
Because we often hear patients will say we don't buy our dressings or we don't buy fresh fruit and vegetables because we can't afford our dressings. Or they say that they've opened the can of dog food and that's what they're eating because they can't afford to go and get, fresh meat. So I think it's very individualized. This comes down to that real assessment and collaboration with that person with the wound. I think that's really the key. Because there are certainly lots of members of the public out there right now that are financially strapped. If you were to say to them, you need to have lots of fresh fruit and vegetables and sources of protein, you may as well whistle Dixie. They just simply can't afford it. So this is where we need to have that really, frank discussion, engage that person, and potentially bring along other members of the healthcare team. Your dietitian may be able to help you identify sources where we could optimize protein intake, for example, who's someone who can't afford, that $46 tray of cutlets, for example. Like there's things that could potentially be done, but it really does need that individualized assessment and thinking very much about where that person's situated, whether it's community, aged care, or whatever the situation might be, so that you can come up with some potential answers. I can't really probably be more specific than that.
Can be very complicated. We have a question from Nairi. You say arginate promotes insulin. Is this something that needs to be monitored in diabetics on insulin?
I think anyone that's got on oral nutritional supplementation, and if they have diabetes, and particularly if their diabetes is poorly controlled, we would need to think about management of their overall health conditions. So this is where involving the dietitian is often important, because we're looking at how oral nutritional supplements in particular might impact on other biochemical markers of malnutrition. So I think really involving the dietitian and the GP, obviously, and other members of the healthcare team to make sure that we're monitoring the effect of nutritional supplementation in the presence of other underlying disease states as well. Yeah, I'm not sure if that answers the question, but certainly thinking about the effect of the supplements and whether they're compatible with other health conditions is important.
Fantastic. Does anybody else have any questions before we wrap up? Not looking like it, so I think, yeah, we might call it there. Well, there was one just from Kim then, and that's for me. How do we get the slides for the webinar? That leads me perfectly into what I was about to say, which is keep an eye on your inboxes over the next couple of days, most likely tomorrow. We'll send out a follow-up email to everyone who registered. So even if you have a colleague who registered but couldn't make it, as long as they registered, everyone who registered will get an email tomorrow with a copy of the recording and a copy of all the resources that Michelle outlined towards the end there. So yeah, please keep an eye out for that email as it comes through. So once again, thank you very much, Michelle.
Thank you. Thanks, Ryan, and thanks everyone for joining us today.
Thanks for joining, everybody. We hope to see you at our next webinar in, gosh, only about 12 days. So it's webinar November, I tell you. There's a lot going on before the end of the year. So thank you very much, everybody. We'll catch you at the next one.
Thank you.
Thanks, everyone.